Good evening and welcome to all who have joined us in our audience. We are looking forward to others who will be joining us, but we are very excited for 2022. We have decided that we will launch a total wellness series, and we are pleased that this evening we're starting with part one, prioritizing your well-being. And we do have three distinguished panelists here that we are very excited about. We do have the details of their bio, but it gives me great pleasure on behalf of the management and staff of Family Guardian and Bahama Health to introduce our partners, Dr. Inga Pratt, Obstetrics and Gynecology, Dr. Patrick Whitfield, who also serves as the Deputy Medical Director at the National Insurance Board, and Mrs. Marisa Mason-Smith, who's the husband at the University of the Bahamas and HR specialist. So we want to say welcome. We are expecting a very interactive session as they present. You will have an opportunity to ask questions, and hopefully before the end of the evening, we will have a chance for trivia again. So I want to say welcome. Thank you for sharing with us, and we will move right into our panel discussion.
Good evening. Hello.
Good evening.
Mrs. Rogers, the entire clinical team, and especially Ms. Butler, who kept me organized through this entire process. Good evening. Thank you so much for inviting me to be a part of this esteemed panel. Let me share my screen. Okay. So my name is Dr. Inga Pratt, and I am an obstetrician gynecologist, which means I deal with women's health. And I'm actually stuck at the hospital right now waiting on a case. So it's a privilege to be able to spend this time with you all. So this topic was a great topic because it's so important and there's so many things that could have been discussed. So I spoke to some of my patients, spoke to some family members and some friends, and I wanted to just highlight some of the things that they thought were important. And of course, we're just touching on a few things, and then when the opportunity arises, we'll be able to fully go into every single aspect, all right? So I have no disclosures. So I wanted to start with a discussion about the pelvis. It was funny, I was watching one of the late night talk shows and they were asking men, they gave a big photo of a female pelvis to a group of men and they asked them to identify the cervix, the ovaries, the fallopian tubes. It was so funny. They were pointing all over the place. So no one really got the anatomy correct. So I was telling the joke to a female friend and she said, honestly, I don't know if I would have gotten all those things correct either. So that really was interesting to me. So I wanted to first begin with a model of the female pelvis, just so you guys have a frame of reference for the rest of the discussion, and just so we're familiar with the female reproductive system. I'm sure we all did it in high school and in primary school, but that was, for many of us, that was a very long time ago. So the female reproductive organs, essentially they consist of the vagina, which is very visible. Most people can see it. And the next part that's encountered is the cervix. The cervix is essentially the neck of the womb. That's what dilates when a woman is in labor. And okay. So we can move to the third slide. Okay. So this is our model of the female pelvis. So the vagina we're familiar with, the cervix is the neck of the womb, and the cervix is where pap smear is taken. So that's actually the area that we get our samples from. This is the endometrium, or the lining of the uterus. So this is where a developing fetus would be. This is also where our menstrual cycle comes from. And the body of the uterus is where you can develop a lot of abnormalities, such as fibroids, such as polyps, etc. The fallopian tubes, there are usually 2 of them, and that's where the sperm and the egg meet. And then we have the ovaries, that's where our eggs develop. So women are born with our eggs, and this is where basically the home port where the eggs develop. And I want you to pay special attention to the ovaries, because there are certain abnormalities that happens in the ovaries that could cause irregular bleeding and other issues. Next slide, please. So this is my favorite slide, because this essentially sums up what happens every single month in the reproductive age woman. So menstruation or menses is when we have our period or our menstrual flow. So the top part of the diagram shows what's happening in our ovary, and the bottom part of the diagram shows what's happening in our uterus, or in that lining that I showed you. So after the lining is shed during our period, the hormones cause our ovaries to develop an egg or mature an egg. At about day 14 for most people, some people a little bit earlier, some people a little bit later, we ovulate or release an egg. When that happens, the lining of the uterus is very, very thick, and the corpus luteum remains to help support the egg and an embryo if the egg is fertilized. If there's no fertilization, then we go back to having our period. So this period, the secretory phase of the cycle, is always 14 days. So if our period is longer or shorter, then that usually means before we had our period, we did not ovulate. So that's called anovulatory bleeding. But if we ovulate or release an egg, and if that egg is not fertilized, usually we have our period within 14 days. Next slide, please. Okay, so I teach with the medical students every day, and essentially this acronym PALM coin, I know coin is spelled incorrectly, but it allows for the E, which shows issues with the endometrial lining. So when you have abnormalities related to your period, the period doesn't come, the period is too long, the period is too short, the period is heavy, you know, we're passing heavy clots. You have to think PALM coin. The PALM speaks to the structural problems, okay? So a polyp, where you see the P, is basically any growth. You can have a polyp in your nose, in your bowel, almost anywhere. So it's just an abnormal growth. It could be cancerous or non-cancerous. The majority of the times it's non-cancerous. And then the L is for leiomyoma. Basically, that's the formal term for fibroids. Everybody calls it fibroids. So that's the formal term for fibroids. All right. And then I want to look at O, which is ovulatory disorders. So O usually speaks to a condition called polycystic ovarian syndrome. And if you look at the orange part of the diagram, you'll see that the eggs are arranged like a pearl necklace, I call it. It looks like a chain around the edge of the ovary. That is very, very, very typical for polycystic ovaries. The ovary tends to be bulky. And when you look at it on the scan, you will see it just arranged around the edge of the ovary. It's very, very typical. So always think any abnormal bleeding, PALM coin. And iatrogenic could be something like the marina causing abnormal bleeding. That's this white thing that you see inside the lining of the uterus. Next slide, please. All right, so uterine fibroids, it's very, very, very common. So it's actually more common in our population, and it's basically a smooth muscle tumor. It tends not to be cancerous, so less than 1% of fibroids are cancerous. However, they can really impact our quality of life because they can cause heavy bleeding. So women may present with anemia. they may present with compression symptoms. So if the mass is huge, you can imagine it pressing down on your bowels, causing constipation, or pressing down on the P tubes leading from the kidneys down to the bladder. So it can cause compression issues as well. And also depending on the location of the fibroid, like for instance, if you look at this pedunculated submucosal, that's just hanging in the middle, that's the same place where a baby would develop. So if you have a fibroid there, it could cause fertility issues. Or if you have one blocking one of the fallopian tubes, then that could also lead to fertility issues as well. So they really have a huge impact on quality of life. And they're managed in a lot of ways, whether with medicine, whether with the Mirena, whether with surgery. So there are a lot of different ways to manage fibroids, but they're very, very common. And they are cause of an abnormality in your period or your menstrual cycle. Next slide, please. So one of the things that I love about gynecology is minimally invasive surgery. So doing surgery without, the big cut on the tummy and one of the ways that this can be done is something called hysteroscopy. So it's basically a camera that goes in through the vagina, through the cervix, and it looks inside of the endometrial cavity. So that allows me to see what is going on inside the woman real time. And this is a hysteroscopy showing, so this is actually inside someone's uterus, and it's showing the polyps, those little growths that we were talking about. So when I do a hysteroscopy and I see those things, then I would just make sure I remove each and every polyp. All right, so this is a minimally invasive procedure called hysteroscopy. Next slide, please. So PCOS, you can press again, please. So PCOS is short for polycystic ovarian syndrome. It's becoming more and more prevalent, and we're not sure why. We don't know if it's our diet or hormones in our diet, but it's essentially a syndrome where you could have two of three things. Either you have irregular periods, because remember, you don't ovulate before you bleed in PCOS. You could have signs of excess testosterone. So you can see here, you could have hair loss. Hirsutism. Hirsutism is just abnormal hair growth for a woman on the face, or thicker hair growth. Acne as well. All right. And then you could also have polycystic ovaries seen on the ultrasound scan. Remember that pearl necklace sign that we spoke about? So that is seen on scan. So any two of those three things means that you have polycystic ovarian syndrome. And it's an important syndrome because it could cause metabolic disorders. It could cause high blood pressure, diabetes, high cholesterol. It could also cause issues with fertility because women with PCOS may not ovulate every single month. Out of a 12-month period, they may ovulate 2 or 3 times. So they can get pregnant, but sometimes it may be a bit more challenging. So this is a photograph of laparoscopy. Again, it's a minimally invasive procedure where a camera is placed in through the belly button and small instruments are placed, and you're able to see, you can see the uterus, which I showed you earlier. You can see the 2 fallopian tubes, and this mass right next to the uterus is actually an ovary, and all of those little pimple-like structures, they are cysts. So this is a bulky cystic ovary that's common in polycystic ovarian syndrome, or PCOS. Next slide, please. So when are some of these irregularities or abnormalities detected? Usually at the time of an annual examination. So an annual examination is great because it's that time to literally focus on your health. And more importantly, it's a time to focus on your wellness and get to that point where you need to be. And during an annual exam, a full history is taken. I get caught up on everything that happened to you during the past year. You examine from your head, the top of your head to the bottom of your feet. And a focus is made, especially in gynecology, on the neck, the breast, the abdomen or belly, and then we do a pap smear, okay? Now, Pap smears are extremely important. I know a lot of people have some concerns and reservations about pap smears, but I'm not a huge fan of pap smears personally in terms of it being done to me, but I go every single year because I know that a pap smear can potentially save my life. All right, and a pap smear is the best screening tool because it's the only screening test that can pick up precancerous cells. So it can pick up abnormal cells that, if left untreated, can become cancer. So that's why a pap smear is so important. It could definitely prevent cancer. So these are the recommendations locally for the Bahamas. So the United States Preventative Services Task Force, the CDC, they have different recommendations, but because we have a lot of cervical cancer locally, these are the local recommendations. So if you're 20 or younger, you don't need a pap smear, all right? It's because the risk of you getting cervical cancer is so low, and if an abnormality is found, we may treat things on the cervix that could lead to problems later on, all right? Ages 21 to 29, it's advised to get your pap smear annually, but normally we don't screen with high-risk HPV. Ages 30 to 65, a pap smear every single year, okay? Now, my patients, when they turn 65, we always get excited and get happy because, you know, once you've had 3 normal pap smears or 2 consecutive normal high-risk HPV tests, you don't need any more pap smears. So you still need your exam, your pelvic exam, check your ovaries and everything, but you do not need the speculum and you do not need the pap smear. So it's always a happy day for my 65 and plus patients. Next slide, please. So we talked about the beginning of life when periods start and abnormalities of our period or our cycle. So menopause is a time, just the same way how puberty is just not one event or just one day you start having a period, it starts with changes. You begin to have hair, you begin to develop breast tissue. So with menopause, it usually takes several years to develop. It's called a climacteric, and it can actually take up to 7 years. And you could slowly begin to have some changes. Usually, we know we're menopausal when our period stops. You have no more period every month. However, before that happens, you could have changes in your menstrual cycle. So you could start skipping periods, or your periods may become a little bit heavier. Another thing that patients may notice would be mood changes. Some patients say to me, Doc, I just start snapping at my family members. Everything they do getting on my nerves. So it's a part of menopause and learning how to manage those things. Changes in sleep patterns. It can also cause changes in our appearance because estrogen keeps the skin firm and tight and taut. When estrogen levels decrease with menopause, you could have skin changes. You could also develop vaginal dryness. You could also develop hot flashes. And estrogen is also important for keeping our bones healthy, keeping our heart healthy. So it's extremely important. So we need to make sure we take our supplements. A good healthy diet helps to counteract menopausal symptoms, as well as we have some remedies such as the black cohosh, soy, flava beans. All those things help to ameliorate the menopausal symptoms as well. And it's as important as ever to make sure that, you know, you check your cholesterol levels and monitor your health every single day with the onset of menopause. In extreme cases in the low-risk population, hormone replacement therapy can also be considered. All right, and that's it. Thank you guys so much.
Thank you, Dr. Pratt, for sharing with us. So what we're going to do is just have our presenters, and then we will have our Q&A following. So may we move to Dr. Whitfield next.
Good evening.
Evening.
Thanks for inviting me here this afternoon. I think functions such as this are very, very needed in our country because most reasons for death and disabilities ultimately arise from choices that we make as it relates to living life. So if I could have the first slide, please. I think it's only reasonable for us to look at what is health and what is wellness. And I'll put it to you that if you were to ask 50 persons, what does the word health mean? You might get 50 different answers. The World Health Organization in 1948 came up as best as they could in defining what is health and complete physical, mental, social well-being. The problem with that was, how do you know? Because I'm pretty sure many of us would have known persons who passed the eye test, who are seemingly perfectly healthy, and then somebody gives you a phone call, guess who dropped down dead? Well, obviously, because things like high blood pressure, high cholesterol exhibit no symptoms, then that person was not, in fact, healthy. In 1984, they revised this definition, taking that 1948 definition into consideration, and they came up with the definition that you see in the second bullet point. But I'll summarize that for you by referring to the third point, which is a little bit more understandable. Health is a resource for life. It's a tool for you to realize goals and aspirations. If, for example, unfortunately somebody has a sudden death at a relatively young age, or have a disabling illness, such as a stroke, chances are you're not going to work anymore. And unfortunately, some people die. Now you have a family. Once you leave the productive side of things, it jeopardizes your responsibilities, not only nurturing of families, but also the economic side of things. How is the surviving partner going to afford a mortgage by themselves? How are your children going to be educated? Some of them have high goals and aspirations. They want to go to college. Will one single person in that family be able to realize their goals and aspirations? So really and truly, it is a tool, a God-given tool, to allow us to realize our dreams. And so if you do not have good health, and you end up with a catastrophic type of situation, it jeopardizes whatever hopes and dreams you've had for your children. A family will be left without a mother or without a father. And so that is critical in terms of not only nurturing, and I don't want to emphasize the money part of it, but it is real. It is real. And so can one surviving member realize and be able to achieve by themselves all the needs of their families? You want a nice house, you want a nice car, you want to educate your children. To a large extent, that flies out the window. And the question that arises is, yes, it's your body, and yes, it's your health. But once you have dependents who are dependent on you, then you're jeopardizing the future of your family. So what I'd like for you to remember, as far as this slide is concerned, health is a tool. Well, not exactly like a car, but think of your car. If most of us who work, we need transportation. And if our car is unhealthy, that is going to affect, to a large extent, our productivity levels of we're getting work on time, getting around, and so on. So bigger picture, well, with the car, you can always get a new car if you can afford it. But in terms of life, you get one shot. And so point being, as far as this is concerned, yes, it is a tool to help you to realize your own personal goals and aspirations. Because if, like I said, if you had up with a stroke, chances are you're going to lose your job. And so all that burden is placed on one person. So that's the concept of health that I'd like for you to remember. Wellness is an active process, which means it is ongoing, and you really have to be aware that you want to achieve better health, get a better tool. And so first and foremost, you need to be aware of your own personal health, because if you're not aware and think that you're fine, then unfortunately bad things can happen. And I will reiterate, most people think that high blood pressure will cause headaches or dizziness, or all sorts of nebulous symptoms. There's a reason why high blood pressure is referred to as a silent killer. Here today, gone today. And I would venture to say maybe about 35 to 40%, maybe higher, of persons have high blood pressure and are not aware. They don't know, because they don't get the blood pressure checked on a regular basis. And then the other part that I have to become aware of making choices towards fulfilling a healthy and fulfilling life. And so that's where we get into lifestyle and exercise and diet and so on and so forth. So wellness then is an active process, something that you actively have to participate in and make some decisions as far as your living is concerned. And going beyond that is making choices toward having a healthy life. Now, the main problem that we see is that making choices part of it, because that requires motivation. And so some people say, well, I'm going on a diet, but the diets tend to be temporary, and most diets do not work with sustained weight loss over a lifetime. Yes, it may help you to go get into a nice dress that you used to wear one time, but after you've gotten into that dress, a lot of people simply go back to the habits that they were doing prior to when they decided to go on the diet. Next slide. So, why are we talking about health, promotion, and wellness to life? And it's fairly simple from our perspective. Medical research links lifestyle choices to the current pattern of diseases that exist in the Bahamas. It's the way we choose to make our life. And what happens if we make bad choices, then we have bad outcomes. So medical research definitively links lifestyle to where we are now in the Bahamas as it relates to the pattern of diseases. Research has also proven without a doubt that unhealthy lifestyles lead to poor health. That should be poor health, without a doubt. Health promotion has the capacity to improve how long we live, the quality of our life. So for example, one of the leading causes of blindness in the Bahamas is diabetes or loss of limbs. Plus, it can decrease healthcare costs. More importantly, if you don't have insurance. So the increasing level of non-communicable chronic diseases in the Bahamas is fueled by unhealthy lifestyles. We no longer in that period in the 50s and 60s where Mama and Grammy used to walk to church, walk to work, or daddies, walk to work, walk to church. Walking was a necessity of life. Most of the food came from the ground. Children walked to school. Now we've reversed that pattern because we get little money and so on. And so we no longer utilize exercise as a necessity, but more so as a means to try to lose weight. And then finally, any change is driven by two things: motivation and education. They're both equally important, because if you're not motivated to make a lifestyle change, then it is highly likely that it would not be very helpful. So what is the motivating factors? A lot of people, it depends on where you are. Okay? Some people with a spirituality background will reference my body is a temple. And if I destroy my body, I'm destroying God's temple. Some people look at the economic part of it, where man, especially men nowadays, when we present it in this sort of fashion. I love my family. My family is my main love in this life, my primary motivating force. If, as I referenced before, something happens to that person and they get disabled or unfortunately die at a reasonably young age, then the goals, as I said before, quality of life of your family, loved ones, children is jeopardized big time. And so along with that is education. But before you absorb the education about how often you should exercise, what type of foods you should eat, you have to be motivated to do it, because when you make that lifestyle choice, that is exactly what it means. That's for life. And so short-term diets, and you go beginning of the year and join a gym that you're going to leave after March, that is not very helpful over the long term. So it's not any start and stop thing that you're doing. You're actually doing something to enhance your life as you go older. So next slide. So my remit is to speak about risk factors in men. So sorry, ladies, but I'm addressing issues as far as men as tasks. So unhealthy diets, which are high in salt. Some of the foods that are highest, and people think that when we say high in salt, we're referring to the salt in the pot. There's no connection between a high salt content in your food and high blood pressure, because the meal would be so salty that most people will not eat it. So that's not where our main issue is. Our main issue is the foods that are high in salt. So for example, cheese has one of the highest salt content of any foods. So all the people who like cheeseburgers and so on a processed bun. So you could imagine how much salt is in that cheeseburger. So that's where we get most of our salt from. Sugar, most people would think of cakes and pies and cookies and so on and so forth. The leading cause of high sugar intake in the Bahamas is sodas. Each can of soda, which has inside of it a sweetener that is equivalent to at least about 10 to 12 teaspoons of white sugar. Juices, not so much, but unless you see a label in the supermarket that says no sugar added, it means that the juice that you're drinking, the sweetness of that juice comes from the actual fruit itself. If you do not see no sugar added on the label, it means that they're putting a similar sweetener in the juice that they would put in the sodas. And so the leading food item or drink, so to speak, that has the highest amount of sugar is salt. And so you might see some people knocking off 3 or 4 of them daily. And that leads to overweight, obesity, and is one of the main driving forces of people who develop diabetes. Fat, especially red fatty meat, lamb and mutton come to mind because the fat is interwoven into the meat. If you're eating a piece of steak that has most of the fat at the periphery, you gotta at least cut that off. But fatty red meat is also very critical. We try to advise people to minimize their fat intake, because obviously fat is implicated in clogging of the arteries and you risk for heart attacks and strokes. Low fiber intake, which might have some implications in colon cancer. Low fiber intake would be foods like white rice, some of our favorite, white flour products. So, because we used to say white bread, so people say, no, I don't eat white bread, I eat whole wheat bread, or whole grain bread. But if you're eating Johnny cake, cakes, banana bread, potato bread, you're using white flour. So don't think of it as white bread, because you're not eating white bread. That means that that's a big gain. But if you consume some of these other products that are made from white flour, then you're defeating the purpose. Processed foods, that's your salamis and the pastrami's, chicken sandwiches that a lot of people buy for lunch. They're high in chemicals as well as foods. And there's some indication that a high intake of processed foods are very important in persons very important factors in persons developing colon cancer. As a matter of fact, the age at which you should get a colonoscopy used to be at age 50 years old, certainly in the US, and I would imagine we can start doing that here soon. Because over the past 5 to 10 years, they've been noticing a lot of younger people, 30s and 40s, who are developing colon cancer. And that form of colon cancer appears to be far more aggressive than the colon cancer that persons in older age groups would get. And there's some theories as to why that might be. And processed foods has been named as one of the possible reasons why there's so many younger people, for the first time in history, developing colon cancer. And when you combine that with the fact that most people do not get colonoscopies at age 50, you can see where this has the danger of increasing the rates of colon cancer, both men and women in the country. We come back again to choices. Sedentary lifestyles, we don't exercise as much as we used to, and there are a number of reasons behind that, some which are reasonable. So if you live in certain communities that do not have adequate green spaces so that you can walk, or where it's unsafe to walk because your transport is limited, then that is an issue with persons who live in such communities where they might have difficulties. Depending on the level of your income, then you could always drive out to Goodman's Bay or go join a gym or so on. But there's a segment of our population that does not have access to those things. And so that is important. There's also some evidence now that excessive sitting is more unhealthy than people who are sedentary. The science community is still trying to find out why that is. So persons say, well, what do you mean excess sitting? So really late, how do you get to work? Especially if you're in a traffic jam. You're sitting, well, maybe, I don't know, 45 minutes, an hour, depending on where you live. When you get to work, what are you doing? Sitting. When you get off from work and get back in the 5 o'clock traffic, what are you doing? Sitting. And when you get home, what are you doing? Sitting and going on Facebook. And so there seems to be a risk of excessive sitting and heart disease, but there's more work on that to be done to find a definitive reason why persons who have excess sitting are not as healthy as persons who have sedentary lifestyle. Chronic alcohol intake, and I'm not necessarily referring to alcoholism. I'm talking about persons who drink, if not on a daily basis, on any other day, and some of the disease processes that can occur as a result of that. So I'm going to make reference later on in this presentation to the fact that chronic alcohol intake is associated with seven cancers. And for the women who are attending, initially it was no more than 1 drink a day, glass of wine a day, in terms of the threshold for which you would have no major issues. Now, the science has suggested that no alcohol intake is probably best, certainly as it relates to breast cancer. So we know, for example, that there is an association between alcohol intake and breast cancer, absolutely without a doubt. And so the general recommendations now, and not many people follow them, is men should not have the equivalent of 2 alcoholic drinks on a daily basis, or translate that out to 14 beverages a week. Women, I guess it depends on your risk factors. If you have a family history of breast cancer, if you are obese, and this is separate and apart from being overweight. There's a difference between being overweight and obese. Obesity is also listed as one of the major risk factors for breast cancer. So if you drink and you have a family history of breast cancer, our advice is that you limit, maybe 1 or 2 drinks a week, sort of thing. But ideally, the research suggests that you should have no alcohol at all. And I'm coming back to motivation and change, right? So these are the facts. What happens from this point on is persons looking at how they're going to adapt to the information. So remember, I spoke about motivation and action as essential in wellness. Tobacco use is obvious in terms of heart disease, not so much lung cancer in our society, but certainly more heart disease, strokes, heart attacks. Unsafe sex is an issue. Even though to a large extent we have controlled HIV infections in the Bahamas, but Dr. Pratt spoke about cervical cancer. And so that is to a large extent caused by the human papillomavirus, or HPV, that is transmitted sexually. So now we are seeing, because men thought they were getting off scot-free by women being affected or infected by HPV, who may develop over time cervical cancer. But now you're noticing penile cancer, rectal cancer, and throat cancer. Not so much in our context at this point as far as we know, but certainly in the more developed countries, the same virus is leading to an increased rate of rectal cancer, throat cancer, and penile cancer. And that's a major thing for men. We have penile cancer, but leave that for another day. Anger management capacity, the lack of anger management skills, I think is very important as we look at trauma, violence, spousal abuse, violence against women, and the ability to control your anger. The scripture says, in your anger, do not sin. And this is a critical part of our society that needs redress. So that's a risk factor in men. Driving drunk, for example, when somebody misses a bumpy car and you want to get up and fight with the person, type of thing. There's a connection between lack of sleep and high blood pressure. Because if you're not sleeping well chronically, that's one of the things that would elevate your blood pressure. Or certainly if you do have high blood pressure and you're not sleeping well 4 to 5 hours a night, that has the capacity to increase your blood pressure, which then increases your risk for heart failure and strokes and so on. Bad eating habits, skipping breakfast, eating on the run, which is important. Eating on the run means lunchtime when you get an hour off for lunch, you got to go pick up the children from school and so on and so forth. And so when you're in that situation, we tend to make bad food choices because the information, we know what we should not be eating, but you're hungry because you didn't have any breakfast. And you need it quick because you have to get back to work or you have to go pick up the kids from school. Then that is one of the reasons why people will make bad food choices, because you're making these choices on the run, even though you know what you should and should not be eating, but you ain't got time for all that. So you eat what's close by, what you can get fairly quickly. Especially in the mornings when you don't have breakfast and somebody in the workplace announces, "Oh, I go down the road, and I'm not going to call the name of any fast food places." And they say, "Well, I don't normally eat that, but right now I'm so hungry, I'll eat anything." And so you come back with your pancakes and your syrup and your processed meat on the bread and some juice, and there you go. So we tend to make bad choices, food choices, even though we know better, because of our life in terms of work-life balance and what you have time to do. And so that is one of the major issues in terms of people putting on weight, certainly, as well as salt intake, fat intake. And of course, skipping meals is another major issue, because I tell people, if you continually skip meals, the body is used to having a certain amount of calories put in it to run the engine. And so if you're skipping meals, you say, I don't hardly eat enough, why are you putting on this weight? The body adapts. Certainly, what it does is it slows down metabolism. And so you're not burning as much calories as you typically would. And so when that happens, the body says, well, I don't know when this person is going to be able to eat again. They might be in a famine. So whatever calories I get, I can deposit that in the bank, which is fat. And so therefore, a lot of those people continue to gain weight because of the body adapting to the decrease in the amount of calories, which is fuel for the body, adapting to a lower calorie intake and saving the rest for a rainy day. I've listed obesity, high blood pressure, and type 2 diabetes as risk factors. You might think of them as diseases, and in fact, obesity is now considered a disease because of the metabolic effects. So if you have high blood pressure and you're not managing it properly and you're not going to the doctor to check, or if you're not taking your meds, then your blood pressure is going to get higher, which has the capacity to damage your kidneys, damage your heart. So eventually you could get heart failure or kidney damage, which would result in dialysis. And once you get on dialysis, that would also have a major impact on your work life or your capacity to work, which could end up causing you to miss days from work or indeed becoming unemployed. Type 2 diabetes is also a risk factor for blindness, kidney damage, amputations, heart attacks, strokes. So the main point of this slide is if you see the outcomes at the bottom that occur as a result of what is in those slides up at the top, then once again, it comes down to choices we make. And I'll come back to the tool, because you're damaging the tool. And if you damage the tool, then you're not going to be able to do what the tool should be accomplishing. Next slide. So what are the leading causes of death and disability in males in the Bahamas? Heart attacks. And these are not in any particular order, even though heart disease is the leading cause of death and disability in the Bahamas. So even though cancer is important, heart disease is still number one. Hypertensive diseases, these are diseases caused by high blood pressure, which basically consists of enlarged heart going into heart failure. The heart is a pump, but once that pump fails, unless you get a heart transplant, your health is going to decline over time. Now, happily, there are now improvement in medications that can control the deterioration of the pump of the heart so people can live longer. But it's not something that is going to be corrected by any medication. And that's those people you see getting very short of breath when they walk. And they have a big brown bag of medications that they carry along with them. Strokes are very important because it leads to disablement, or unfortunately, it can lead to death. And for some reason, ladies, that I cannot give you a solid answer now, women tend to do worse as a result of stroke than men do, in terms of the level of disability, the level of loss of power, and so on. And so increasingly we find that younger women, when it's a younger women in their 40s and so on, are developing strokes. And they take a longer time to improve than males. Trauma, for the most part, motor vehicle accidents, motorbike accidents, homicides, assaults, and so on, are also risk factors. Diabetes and cancer. Now, these are 6 of the cancers that are closely linked to chronic alcohol intake. And I will remind you, I'm not talking about alcoholism. I'm talking about people who drink as a hobby on the way from work. They stop by the resting spot and they hang out and so on. Colon cancer, pancreatic cancer, and pancreatic cancer is a really bad boy because the initial symptoms are so non-specific. By the time we recognize that the person has pancreatic cancer, they would have passed away within 3 to 6 months. I know for all the cases of pancreatic cancer that I have seen, and they've all been in men, their lifespan was at most 1 year post-diagnosis. Oral cancer, cancer of the mouth, tongue, and so on, prostate cancer, liver cancer, cancer of the throat, pharynx, and cancer of the esophagus. The cancers of the voice box, or the pharynx and larynx, larynx, voice box, pharynx, that's the back of the throat, occurs more in men who both smoke and drink because they have an effect. The smoke, the alcohol causes abrasions and damages the lining of those body parts. And then the smoke with all the contaminants, tobacco, can penetrate easier and lead to these things here. So that's as far as the cancer is concerned. And I would reiterate, this is in men. The cancer that is associated with women and alcohol is more related to breast cancer, and maybe to some extent stomach cancer. And the last thing on this slide has to do with lifespan. Now, Ms. Rogers is wondering for a long time why y'all are living us. And there are many theories. And this goes back to the 1950s. So accordingly, in the Bahamas in 2018, the life expectancy in males was about 6 years shorter than females. Now, we have to be sure that we understand what this term means. What life expectancy means is that a child born in 2018, male, if nothing changed in terms of lifestyle and habits, if we still where we are, then compared to where we are now, then the average male will have no longer than 72.6 years to live, and female 78.6. In a lot of the developed countries, they're like US, England, Europe, and so on, their lifespans are now in the 80s to some extent, in the 80s. So I don't have a reference point for you this presentation, because this could take a presentation by itself. But our lifespans are not as long as in some of the more developed countries. So you all got us by about 6 years. So fellas, we gotta try to do something, because we gotta try and make this right. And I think a lot of that has to do with women tending to utilize healthcare facilities more commonly than males do. I asked a male patient of mine, well, why don't you come to the doctor? He said, because he doesn't like to come to the doctor because he don't want to hear no bad news. I said, okay. And so women tend to use healthcare or go to visit doctors on a more regular basis. But to be fair, I've noticed, and I don't know if this has anything to do with national health insurance, but more and more men are now showing up, young men as well, men in their 40s and 50s or so on. The doctor come for a checkup. And I asked them, so how come you start coming to doctors now? And they said, well, I gotta live for my family, man. I gotta take care of my family. But what that translates to is the white syndrome. But happily, a bit of happy news is that I've noticed that more and more men are actually coming for physicals, and we've diagnosed a number of men with diabetes who did not know that they were diabetic, or men who have excessively high cholesterol, dangerous levels of cholesterol, but because high cholesterol does not cause any symptoms, they would not have known, and they go for another 4 or 5 years, and they potentially could end up with a stroke or heart attack. So that's the good news. And I think I have one more slide. Right. So I'm going to end with this because I don't want to give pure bad news. I'm talking about risk factors and the most common causes of death and disability. So I want to end this with some generic and broad-based healthy lifestyle recommendations. And this applies to both genders. Healthy diets, of course, the ones that I think are critically important, I've highlighted in red. Whole grains. Now, you see, the problem with whole grains is not everybody like that brown rice because it's too hard and difficult to chew. You want white rice. But whole grain bread, fruits, vegetables, fish, poultry, nuts, legumes of beans and peas. Those are some of the more healthier foods to eat. You will notice that there's not very much in terms of this particular healthy diet food thing. You notice that there's no red meat. And that's because of the propensity of red meat possibly being associated with colon cancer as well. But if you're going to eat red meat, then it's best to eat lean red meat, like pork chop or pork chop loins, or something that have very little fat on the periphery, or a good piece of steak that you could trim off the fat from the periphery before you eat it. Secondly, cut sugar. All those things that I mentioned as poor diets, this is now the reverse in terms of what you should be eating. So cut to the extent possible the levels of sugar intake, which comes back to soda, juices, pastries, and so on, ice cream, saturated fats, which is fatty red meat, deep fried foods, and there goes crack conk with anything. Deep fried foods, because of the white flour and the oil and the deep frying and so on and so forth, they can increase your cholesterol significantly. Processed meats, we call them sandwich meats, and snacks, which are fairly high in calories but have very little nutritional value. Increase physical activity levels, at least 150 minutes per week. That could be 30 minutes, 5 days a week, or however you want to divide it up. But that has been proven without a doubt to influence the health of your heart. People tend to live longer who engage in this practice. And that's walking. If you're going to do some more vigorous activity, playing tennis, jogging, weight training, then the recommendation is at least 75 minutes per week, because you're burning far more calories by the more vigorous exercise that you're doing, and you're doing a harder, better workout. Ensure compliance with immunization recommendations. Basically flu, as you get older, the pneumonia vaccine, because people in their 70s and 80s who catch the flu are very prone to catch pneumonia. And that's one of the reasons why the death rates from flu are most commonly in the very young and the aged. So I would encourage all persons, well, the flu season is just about gone, so we didn't pass that gate. But it's very important that persons in that age group, especially if you have pre-existing conditions such as diabetes or heart disease, that they should take the pneumococcus vaccine is referred to prevent them or minimize the risk of them developing pneumonia, which can potentially lead to death. And the HPV vaccine that we referenced earlier, this is the vaccine that protects you against human papillomavirus. Unfortunately, it does not work very effectively beyond the age of 24. So you have to take, that's why they start giving them to youngsters, 14, 15, 16, and so forth, once their parents agree. But the vaccine for HPV is minimally effective after the age of 24. Make use of screening recommendations in men. That's prostate screening, colonoscopies. They might not be able to afford a colonoscopy, but certainly people with high risk, especially persons who are obese or who have a family history of colon cancer. Screening is absolutely important. And I totally agree with the recommendation for pap smears. That has a critical importance. But a lot of people don't get screened in a timely fashion. And perhaps that's one of the reasons why we have a relatively high rate, though not as bad as heart attacks and strokes, of deaths from cancer, because most people in our experience who have cancer present at a very late stage. And the later you present, the worse the outcome will tend to be. Stress relieving practices, I think we will get into that after I'm finished speaking. And lastly, anger management skills. That needs to be greatly improved so that we do not react in anger, and hopefully that can minimize or mitigate against the rising levels of spousal violence, fights, homicides, and so on. So this is just a broad overview of what some of the healthy lifestyle recommendations are. So before I finish, I've given you a basic understanding of what health is and why it's so important, because anybody said, boy, I got to get healthy, but you're not quite sure what that means. So we should have a basic understanding of what the term health means, as well as what wellness means. We've talked a little bit about the fact that science, by all means, have proven that most of the illnesses that we see now are preventable, and as a result of healthy lifestyle choices. And so since the science is there to prove that by cutting the consumption of these bad foods and so on, that we can live longer and meet our commitment to our families, friends, and loved ones by having to last longer in this life, then that technology is there. The information is there. What it comes down to is motivation to do it. And I've spoken about the persons perhaps in their 40s and 50s who have the most to lose in terms of not having the capacity to care for their families. but also in the older age groups, persons over the age of 70 and so on, they have risks as well. So surely something that's going to carry you. But what you do not want is to be caught in a situation where you're 65, get a very serious illness. You do not have access to insurance. You're not insured. And that limits your access to timely health care. So what your health basically is going to be in your 70s and 80s and largely depend on your lifestyle in your 40s. So with that, I will end my presentation. I think I might have gone a little bit over my allotted time, but I thought it was important that we have a basic understanding as to why Ms. Rogers and those put on a seminar like this, which I think is an excellent idea. And we have tracked from where we are now in terms of our health, why we are there, and what can be done about it. So with that, I'll end my presentation.
Thank you very much, Dr. Whitfield, for a timely presentation. And now our final presenter for the evening is Mrs. Marisa Mason-Smith, and she will speak to us on emotional health. And to our viewers, get your questions ready. Our panelists will be more than happy to answer those.
Good evening, and congratulations to the team of Bahama Health and Ms. Rogers and her team for the vision on putting on such a timely and important wellness series. And this evening, my focus is on emotional well-being and setting boundaries. Now, my two doctors, it tells me that we got a lot of work to do in this country. And I'm telling you, it was quite informative, and I'm very humbled and pleased to have been asked to join this distinguished panel this evening. And so my focus is on emotional well-being. And I'm going to ask a question to the audience. Do you believe that women are more emotional than men? You can just put it in the chat. You can just put it in the chat, and let's see what your response is. Well, the research has shown that men are equally as emotional as women, and in many cases can be more emotional than women. But because of cultural environments, we tend to believe that women are more emotional, and that is because culturally we believe, oh, it's that time of the month, so she's acting like that, or things like that. And so here we go. Here's another woman. You put them in leadership, and you know what? They don't know how to handle pressure. But you know what? Research has shown that men cannot handle pressure either. So what we are all about now this evening, and which I'm going to share with you, is really what is the emotional well-being of a person. And so this evening, I'm going to ask another question to you. The myth: you should be the last priority in your own life. A good man or woman cares for everyone else and forsakes their own needs. You should be ashamed of taking care of yourself because you're being selfish. How many times do we hear that? You're so selfish. You're only thinking about yourself and not about others. Do we agree with that? And then, but the fact of the matter is you are all worthy of self-care, of doing what is best for you. Sacrificing your own time, energy, and resources, and even money by neglecting yourself depletes your happiness. True self-care should be about understanding yourself enough to know when something in your life is wrong and finding out how to deal with it. I think this is an area, emotional well-being, and is one of those areas that I think we don't spend enough time addressing and coming to a clear understanding of how important our emotional well-being is. We talk about the physical, we talk about all the other aspects, and we've heard it a while ago, but your emotional well-being, according to the Mental Health Foundation, says it's a positive sense of well-being, which enables an individual to be able to function in society and meet the demands of everyday life. People in good mental health have the ability to recover effectively from illness, change, or misfortune. The National Center for Emotional Wellness defines emotional wellness as an awareness, understanding and accepting of our feelings, and our ability to manage effectively through challenges and change. As we are still in the pandemic, we all can say that we've been affected emotionally by life changes, whether COVID, whether it's been the loss of a loved one, divorce, sometimes a birth, wedding. Our emotions are a part of who we are. But when we look at COVID-19 and how it's affected our emotional well-being and its effect on productivity in our workplace, we must be aware of what our emotional state is, i.e., as an organization, and then as employees, because it is going to cost us in the long run if we do not pay attention to the emotional health of our organization and employees. When we think of all of the economic challenges that we've gone through, all of the listening to Dr. Fauci, listening to this one, to that one, to the government, to this government, to that country, we've all become overwhelmed as to who is speaking the truth, to vaccine or not to vaccine, to get the booster or not to get the booster. And all of this affects our well-being in terms of some of the decisions that we make. And when our emotional well-being is affected, our sleep patterns are affected, our nutrition is affected, our concentration is affected, our physical and mental health and coping skills are impacted. And again, we look at to quarantine, not to quarantine, the impact of the social media. So these are all aspects: to have children, not to have children, to divorce, not to divorce, stay married, he's a provider. Whatever the decisions are in life, we have to manage our emotional well-being and health. And so this evening, I'm going to speak to us that we must know what it takes and what can you control in your sphere. You can control your positive attitude. You can control what you listen to. You can control the kind of persons that are in your network. You can also control the things that you want to do, the fun things you want to do, and how you want to live a productive and happy life. We cannot control how the government thinks. We cannot control the actions of others, how the employers feel about us, how people feel about us. We cannot predict what is going to happen. We cannot believe that we have the answer to all of the questions that affect us in our environment and in our country. We cannot affect whether or not, I know people are all affected with the cost of living in the country. You cannot control some things, but you can control your emotions on how you respond to it. And I'm saying respond rather than react, because when we react to things, then, or items in our lives, then you become very emotionally unstable. So our emotional well-being is that we need to safeguard that for our own emotional stability and to be comfortable with our own emotions. When we have emotional well-being, we know ourselves. We know exactly what are the triggers in our lives. What is going to make me get angry? What is going to make me happy? Who should I be dealing with? Who should be in my network? These are very important aspects because emotional health is very costly to an organization, because if you have an emotionally sick employee base and they're having to go to the doctors all the time, productivity is going to decrease. Job performance, non-existent. And if you have insurance, insurance claims are going to go up. So emotional well-being must be one of our priorities, that we ensure that we take care of our mental and emotional health. If we are going to be emotionally healthy, we must set boundaries in our lives. And I know many of us feel as if we are super women, super men, but we must learn to say no. No, I cannot do it. No, I am unable to do that. Or simply no. It is a complete sentence. I know many times we want to be all things to all people. And guess what? We do that at the cost of your own emotional health, that end up leading us to being burnt out, leading us to depression, leading us to be anxious, and you cannot be effective or productive. You must be assertive. You be kind but firm. Use assertive languages. And I'm saying this to employers in particular and employees. You have to know the temperament of your superiors, of your leadership team, and vice versa. The human resources department, more than ever, have to demonstrate that they care for their employees, that they're more empathetic towards their employees, and they're sympathetic when things happen. And that's another conversation. And so we need to ensure that we safeguard our spaces, your physical and emotional spaces. There are some people you don't want close to you. I don't care. Sometimes it's your brother, sometimes it's sister, sometimes a friend. But you know that when certain persons come in your environment, like we say in the Bahamian vernacular, they yuck up your vexation. They just make you vex and they get your spirit crossed. You have to be mindful of your boundaries. Even with the telephone calls of certain persons, you need to know how to set those boundaries. Set those boundaries even as it relates to the use of technology. Many times we're using so much social media that we do not take the time to set the boundaries to determine, where am I in all of this? If you need the support, reach out and get the mental health professional support when you need it. If you feel as if you're exhausted, tired, weary, and everything is coming at you one time, I encourage you to ensure that you seek the professional help. I know that in our environment, in our culture, seeing a psychologist, psychiatrist sometimes brings stigma. But I can tell you, even psychologists, psychiatrists, they go and visit the professionals to help them out. So I think the time has come where we recognize that when we need the help, when we cannot handle certain aspects of life, the changes in life, the ups and downs, the unemployment, the highs and the lows of life, that we know where to go and get the support that is necessary to help us to become positive and healthy in our lives. Setting boundaries can boost your well-being. Boundaries involve clear borders between other people and all of us on a day-to-day basis. They help establish our identity, differentiate our individuality, and help us indicate that we will all not hold ourselves accountable for. So when we're talking about setting boundaries, we need to look at the emotional side of it. And in our conversation, in our communication, and the whole notion of emotional intelligence, our awareness. Are you aware that you are feeling burnt out, exhausted, weary, can't think, can't concentrate, can't focus? Well, you know what? You need to know that when your body changes or your emotional environment changes, that you need to set boundaries and get the help what you need. Even in our communication, from an emotional perspective, there are times we must say, even in our families, in our employment, that, you know, I'm not willing or able to discuss this at this moment, because you know exactly your state. You do not know the state of other persons. And so whether you are a leader, a supervisor, an employee, we must be aware of all persons within our environment, their emotional state, how we communicate with each other, our tone, when is the best time to speak to this person, especially when you're talking about termination of employment or downsizing. You need to find the right time when you who have to perform that duty is emotionally strong and capable of doing it, because you're dealing with people's emotions. The material side of it. You're talking about time and energy. Maximizing your time and energy. We all have 24 hours in a day. How are you maximizing your time and energy? Are you talking all day? Are you watching television all day? Are you on cell phone all day? Are you on Zoom all day? Because that alone contributes to emotional burnt out, and it tires you and it wears you out. Your mental capacity. I respect your opinion, even though I don't agree, and I'd like you to respect mine. In our communication, when our mental and emotional state is intact, we're able to respond and give personal and professional communication to all the persons that we talk about. The pillars of well-being are emotional, our career, social, financial, and physical. Balance versus boundaries. When we talk about emotional balance, we're talking about a state of equilibrium to bring harmony or proportion to our lives. We know exactly that we all need work-life balance, but it calls for concentrated and deliberate and intentional effort to balance that. I know for all of us who work with families, you're talking about you have to do the food store, you have to do the groceries, you have to do everything, pick up, drop off, everything. And so sometimes our life becomes imbalanced because we're doing it all. We want to be that executive, yes. We want to, and I encourage persons, we know we want to achieve more, we want to accomplish more, but at what price are you willing to pay? So balance is critical to our emotional well-being. Boundaries. We all have to set personal boundaries, because if our state is not in the right frame, we can be yelling and screaming and shouting and raising our voices at persons who we love, and they're very quiet, our family, because you have not set boundaries or you haven't balanced. And so even in terms, we talk about boundaries, you need to be organized. You need to have time management skills. You need to understand that there are certain persons after 8 o'clock, do not call my house. That's a boundary. Do not call my house before 6 a.m. in the morning. I do not go on social media before 11 a.m. in the morning. I do not answer emails before 9 a.m. However it works for you, you need to set your own personal boundaries so that you can be effective. In your relationships, you want your relationships to be mutually respectful, but you also want to be caring and loving. So you need to know, how am I going to achieve all of this? And that is very, very important in setting boundaries in our homes, in our workplaces, because it doesn't matter how super women or men we think we are. You are not required to set yourself on fire to keep other people warm, just to say that you're a good person, you're a nice person. Oh, she does all of this. And listen, it's still all about your mental and emotional health. We must set boundaries. And the ABCs of self-care, and they are awareness, balance, and connection. The ABCs of self-care: awareness. Self-care begins in stillness. In our busy and quiet lives, you must find a time to rest, find a space for solitude where nobody knows where to find you, when you can be quiet and alone, and you can take time to reflect on your next course of action, what you're going to do, what are my goals, where do I want to go? Sometimes we just need that time to be alone, to think through some problems, to think through a matter that requires concentrated effort to get the results that you desire. Many people I've found are afraid to be alone and afraid to be quiet. The minute they walk in the house or jump in their car, the radio is on, the television is on, and there's a lot of noise. That's good in its place. But when we're talking now about self-care, we're talking about emotional well-being. We must be aware and pay plenty attention to stillness, being still, being quiet. Whatever that alone time is, do it. I've heard many women in particular says, my only quiet time is in the bathroom. I lock the door and I get in there so nobody bothers me. Well, if that works for you, well, let that work for you. Another, the B in the ABC, is balance. Self-care is a balancing act. That includes action and mindfulness. And when we're balanced, we're able to make better decisions. We're able to manage our behaviors and our attitudes. Research has also shown that persons who have balance in their lives are much more confident, competent, and they tend to have better human relation skills, and they know how to get along well with people. So that is a part of balance. And then the C of connection. Healthy care does not take place solely within oneself. As people, we are better together when we have healthy relationships, healthy family arrangements, and we're involved in social groups. We're involved in nature. We find those activities that are so important to us. Spiritual awareness and practices, and therapy. There's so many aspects how we can connect with people. And research has also shown that women do a better job of connecting in various networks, in families, than men. And that is one of the reasons why women tend to outlive men. Dr. Whitfield, that may be part of the solution right now. Research has shown that when men retire, and this has been about 3 years ago, that they don't tend to live beyond 5 to 7 years. And women tend to live much longer and really look more forward to retirement because they're always involved. Why do we need to engage in self-care? To prevent burnt out, prevention, and recovery. Have you ever dealt with someone who has been burnt out? There are 12 stages of burnt out, and there's a syndrome that leads to depression. It causes unnecessary conflict. When people are burnt out, listen, their productivity levels are down. They are miserable. The minute you see them, you look like they've been baptized in lemon juice. You know, they're just miserable looking. And whether they're wearing MAC makeup or fashion fit, whatever, that inner self comes out. they don't have that glow in them. So we have to be very mindful when we talk about persons not taking self-care as important. Your behavior changes when you're burnt out. You lose contact with yourself. You don't care how you look. You come out the house any kind of way. You do what you feel like. You eat anything. You eat on the run. You go on the run. You do not know how to resolve conflicts. You deny the problems and the issues at hand. Everybody is a problem except you. However, when we engage in self-care, we tend to create a more positive work environment. We improve the emotional, physical, mental, and spiritual health of those in your family, in your own self, and you begin to love yourself. There's nothing wrong with loving yourself. And it's important that you learn to love yourself, because if you don't love yourself, it's very difficult for you to love anyone else. And so I encourage us all to take that time to love on yourself. Take that time to go to the gym. Take that time to buy that extra lipstick if you want it. Get your hair done. Do something special for yourself. Read that special book. Whatever that is, you can do that. Why is self-care important for well-being? Practicing self-care does not mean you are choosing yourself over your loved ones. It means that you are simply being mindful of your own needs. And we all have needs. Men have needs, women have needs. And when we have identified what those mindful needs are, you're able to support the people you care about. And many times we put our children in front of everything we do. We do everything for our children. And really and truly, at the end of it all, the children appreciate that, but they really don't care about your self-care. They're not concerned about your emotional well-being and activity. They just want what they want. And so even as parents, we have to set boundaries, because at the end of the day, and I'm going to say this in the next slide, is that we give all to our children, we give all to our spouses, to our friends, everybody, and we leave ourselves out, and we leave yourself stressed, and you are unable to help yourself. The circle of self-care means that you are responsible for your own self-care, your sleep patterns. You must be mindful of what are the things that are important to you. Fresh air. What does it mean to eat well? Reading that book that you so desire. And so that is very, very important. What is your circle of self-care? And this can include many things that are important to you. And as I wrap up, I want to say that you cannot serve effectively from a place of depletion and exhaustion. When you are exhausted and when you are depleted and emptied yourself, what do you have to give even to yourself? The goal to feel vital and balanced, free from depression and activity and anxiety, will require us to take some spiritual self-care. That may call for us prayer, spiritual community involved in that, meditation, forgiveness, very important. If you're going to have emotional well-being, we must learn to forgive others and do not be the slave of that person that people people don't even know that there's some ought against you and you have not forgiven them. Learn the art of forgiveness. Forgive even if you're not even sure, so that you can find peace and health in your own life. It is shown that people who do not forgive are persons who are more prone for cancers, stresses, and heart attacks. And so we want to ensure that if our emotional health is strong, we need to forgive and find purpose and meaning to life. Find the people support in your life. The people who are going to give you sound counsel, persons who are going to be positive, encouraging, inspirational, and persons who will give you sound advice. Be mindful of the people that are in your circle. If they're not adding value to your life, they are definitely taking value from you and leave you depleted. There are some people, every time you see them, they got a problem. Listen, there are some people you have to run from depending on your state and where you are. Self-care also requires us to have some positive self-talk. What are your positive beliefs? We also need to have those affirmation statements in our lives that says that I can do this. The word of God says, I can do all things through Christ who strengthens me. But emotionally, are you able to handle that? How do we handle grief? Because grief is a part of our lives, and grief takes on so many forms. So again, from an emotional and mental perspective, we need to understand if I'm grieving, I'm hurting, I need to get the help and support I need. Find a good therapist, find a good friend, invest in your own mental health. Your lifestyle, and we heard a lot about that from the doctors. What is your lifestyle structure and routine? Do you take time to relax? Do you set goals? Is your work fulfilling? Or are you just on a job? Are you just exhausted with your job? You don't like your job, but you got to show up because you know you got to pay the bank at the end of the month. You got to pay that credit card. Are you finding things in life that gives you fulfillment and pleasure? If your job is not giving you the level of emotional relaxation that you need, sometimes you need to go and have a conversation. If you're not having good relationships with your manager, your supervisors, you need to have that conversation and express to them how you're feeling. And again, we need nutrition. We need sleep. We need exercise. We need to drink a lot more water. We need to take our supplements. And we need medication, as is required. Doc has talked about that. And we need to practice our breathing skills. And we need to know exactly where and who am I. Once you're able to identify exactly where you are emotionally, and you know who you are, you know that you're exhausted, you know that you're burnt out, do not take on another task. Yes, there may be a promotion coming up and you feel that you have to do all of these things to impress your employer because you want this promotion and to show that. Listen, do your best on your job wherever you can. Because if a company has to make a decision on who is going to go or who's going to stay, and you feel as if you've been going above and beyond, it happens to you, trust me, you're going to have an emotional meltdown. Always be your best. Take your best self to work every day. Be your best every day. And remember, you can do anything, but you cannot do everything. Remember, for emotional health, you must remember that you cannot pour from an empty glass. Take care of yourself first. Thank you.
Thank you kindly for sharing so much with us. So we've had a really packed evening with good information. Just want to thank all of our presenters, and I would turn it over to Mrs. Irene Pintard, who would moderate any questions. You can use the chat if you have questions for our panelists at this time, or you can open your mic and speak.
Good afternoon. Thank you so much to our presenters this evening. We have a few questions that came through the chat earlier. And for you, Dr. Patrick Whitfield, once diagnosed with hypertension, how often should one check their blood pressure?
At a minimum, every 3 months, 4 times a year. That is to make sure that the medications and the diet and the lifestyle changes are working properly. And to also monitor to make sure that you have not received any damage to any part of your body, precisely to do with the kidneys, for example, and that your heart is working good. So at least every maybe 3 to 4 months, depending on your level of control.
And Dr. Whitfield, being in the insurance field, we find a lot where we have our clients tell us that they take themselves off their medication. Can you tell our viewing guests why they should not take themselves off their medication?
Because over time, the higher the blood pressure is in the system, in your system, you can be damaging, as I said a short while ago, damaging your heart and your kidneys. As a result of that, you could end up at a much worse place than you are. So hypertension in and of itself does not cause any symptoms. But if you get heart failure, you become short of breath and lack of energy. If you develop kidney failure as a result of long-term hypertension, then potentially you could end up on dialysis. So it is the complications of the high blood pressure that can cause you a major problem, certainly in terms of lifespan and the quality of your life.
Dr. Pratt, a question for you. Please explain why a woman does not need a pap smear after 65 years.
Just let me intervene here. Dr. Pratt was at the hospital, and I think she's called into her emergency. So I don't know if Dr. Whitfield can help us with that question, please.
Well, if after 65, the the frequency of sexual relations tend to decrease. Secondly, that stoppage of the pap smears has to do with specific references, which include the fact that I think if the person had 3 consecutive pap smears that were normal, then the risk of developing cervical cancer decreases significantly. The science suggests that maybe 10 to 15% of women who get HPV will go on to develop cancer of the cervix. So it's not that everybody who gets it will develop cancer. And so I think that recommendation is based on a specific situation where you've had 3 consecutive negative pap smears. And then the time frame between contracting HPV and cervical cancer is somewhere in the range of 10 to 15 years afterwards. So it's not a situation where if you get an infection with human papillomavirus, that automatically within 5 to 10 years that you will get cervical cancer. And it is because of pap smears that the death rate from cervical cancer has declined significantly over the past, I would say, 10 to 15 years. It's still with us, but it's not as prevalent as it was prior to, when persons would have access to pap smears.
Thank you, Dr. Whitfield. Ms. Mason-Smith, can you explain to us the importance of vacation, stepping away from the desk and having that separate time from the job?
Vacation is very important because it gives you that time to get some rest, recalibrate, refocus, and enjoy the pleasures of life. I have found as an HR professional that there are many people who believe in building up this vacation. So whenever they leave, it's paid in dollars. But you'll find that, and the research has shown that persons who take vacation and come back, they're more refreshed, they're more revived, they're able to perform at a higher level. And we all need a break from our jobs. Anybody, and this is a warning sign, a flag, red flag, when people refuse to take vacation. Sometimes you need to dwell into that, because sometimes there is situations at home that are really probably hostile and unhealthy. There are other matters that are happening on the job that they cannot afford to not be, and I don't want to accuse anyone, but there's also been signs of pilferage, or that people who refuse to take vacation. Vacation is given to you to take a mental and emotional break, and you're encouraged to take it. And employers should encourage persons to take their vacation annually. Right now, as a result of the pandemic, people are on a mental vacation. It seems as if many persons are not wanting the normal workflow has changed. And so what has become normal, or what was abnormal, is now normal. And so as a result of COVID, people are burnt out even more. The anxiety, the fears, the loss of loved ones. And so we all need time away from the normal and from the regular in order to be productive. So I do encourage employers to ensure that employees take their vacation when it's necessary. I know there's a group of us, my friends, we look forward to vacation. It's a happy, happy time, you know? But vacation is important, and I encourage all persons to take their vacation.
You would have mentioned throughout your presentation, persons not, or us having a stigma on visiting the psychologist. What do you tell a sane person or someone that's on the job, probably stressed from work? What do they do, or what do they say when they're calling in to make that appointment?
Well, most organizations or larger organizations have an employee assistance program within the Human Resource Department. And the Human Resource Department can make those necessary appointments for that employee. I do recall, and Ms. Charlene, she's one of the smartest women I know in the insurance industry. She's taught me a lot of things that I know. And I do know that there are some benefits in group medical, in insurances, that you can claim for so many therapy sessions a year. So I do say you have to build that relationship, make that relationship with HR, and to speak with the HR manager, if they don't have an employee relations, who can refer you to someone who can provide the necessary support. And usually most organizations have about 2 or 3 resources on hand: a psychiatrist, a psychologist, a medical practitioner, to whom they send for second opinions, or to ensure that you get the necessary help that you need. So I say, if that employee is feeling stressed and exhausted and need help, reach out to the HR department. I would also know, I do know that there are many organizations that have a 1-800 number that employees can call direct and get counseling and help 24 hours a day. So it depends on your organization, but I think your first response should be to the HR department. If you have a good relationship with your supervisor, your manager, your supervisor or manager should be able to see some signs that is saying that this person needs some help, or vice versa. You can go to your manager and say, listen, I'm experiencing this. I'm suffering from alcoholism. I'm suffering from whatever it may be. I am not productive. I'm not effective. Help me. I need help.
Thank you, Ms. Seth. Dr. Patrick Whitfield, recently my spouse had a checkup and was referred to have a stress test. Can you give the details as to what occurs during a stress test?
That a stress test is meant to try to gauge if the person is at risk for a heart attack. And so what they do is they put them on a treadmill and they do a cardiogram at the same time, because they want to see whether or not stressing the heart out by virtue of your level of physical activity will cause any changes in the heart. And so basically it's utilized to assess your risk for heart attack. It's not a screening tool. There's a reason why the doctor would order a stress test, because either they want to rule out imminent heart disease, or they suspect that the person might in fact have a blocked coronary artery that might need to be addressed.
Thank you. Okay, there's no further questions in the chat. Does any of the viewing guests have any questions that they would like to ask our presenters?
Can I ask a question? And I'll see by the show of hands, how many of us feel like we take care of others more than we take care of ourselves? You could just send the hearts up or emojis up. And we have to be honest. How many of us think we take care of everybody, our house, our children, mother, grandmother, everybody, and neglect ourselves? And we think we're okay with that. Just send some emojis up and say, you know, you're guilty of it. You know, you're burnt out at the end of the week. The children, the virtual school, the food store, they're eating more at home. They're stressing me out. I got to pick up, I got to drop. And how are you coping with that? Do you feel that you're coping at your maximum capacity? I'm going to throw that question out to you, to the audience. Everybody is good then. We don't have any emotional issues on this group. Everybody is perfectly well. I like that.
Do we have anybody that would like to share?
I would respond. I think for me, I think I'm doing well doing it, and maybe it could be wrong, but while I'm taking care of everybody else, I get pleasure in doing it. So it seemed like it's a good thing, but it could still be a burdensome thing, which I don't, you say you don't mind, but in the background, it's actually affecting you. And sometimes that's difficult to identify because of the fact that you have a level of satisfaction in doing it when you see other people happy and they're well and they look like they're doing good because you've done so much for them. But it could also have a hidden sign at the behind the scenes that you don't really recognize unless someone points it out to you eventually.
And someone pays for that, you know. Someone pays for that because one trigger and they'll see the next side of Miss Thorough. You know, as wonderful as she is and as good as she is, you say the wrong thing and then everything comes piling down on it like a ton of bricks, you know? And they don't know what I've been through. I just came through this traffic. I just had to feed this one, that, and all these other chores and responsibilities that we have, but we do not put them in perspective. And that's why I talk about time management. How do you manage your time? Do you leave everything for Saturday to go to the food store and wash the clothes, clean the house? You're exhausted all week. You've been homeschooling all week. Everybody's calling on you to solve the problems. When does Ms. Thorough find that quiet time to reboot, rebuild, recalibrate, and to be her best self?
That's true. And sometimes those triggers are what people will say, oh, that's just her. And it's really something else, but it becomes a way of life or a part of your character that they identify. And it becomes an acceptable norm when it's really not.
It also becomes negative because people say, you know what? Don't bother Ms. Thorough because she got a short fuse. And you become branded in the organization as a troublemaker. You can't depend on her. She's not reliable because all of these behaviors affect our work environment. Someone is going to get the blow along the way. Whether it's the dog when you reach home, whether it's somebody's going to get it if you are not emotionally balanced and healthy. And that means being intentional about what we take in, what we're listening to, what we're doing, and knowing your load limits. You know how much you can do. We want to look good to everybody. And then you go to choir practice, then you go to dance practice, then you have to do all these things and keep smiling, and one day you crash. And then they say, really? I didn't know she was going through all of that. And then they have to go see Dr. Whitfield because they're stressed out, exhausted, when you need to be focusing on your own emotional health.
I have a question for you. I noticed you emphasized the word forgiveness in your presentation several times. Can you speak to that? Because sometimes you have, you could be in places where you're either dealing with bullies, whether this is children, even as adults. Sometimes persons can be blatant, in their, approach. What, in terms of your well-being, what is your, I guess, recommendation or advice when you find yourself in such situations?
I would say, first of all, identify that there is a problem. Secondly, approach the problem or the concern or the issue with much prayer, depending on what the situation may be. Find the right time for it and determine what do I want out of this relationship? How important is this relationship to me? Whether it's a family member, whether it's a work relationship, whether it's a social relationship. Forgiveness is part of life's healing process. If you are going to be productive, if you're going to live a long, healthy life, we have to learn to forgive others. Sometimes people are not even aware how they've offended you or persons have hurt you in some which way. But you who understand and see or know that there's tension between the parties at home or even if with your spouse, let's say a spouse, when things ain't right at home and you put on that big t-shirt and like, listen here, what that language is. So there's sometimes silent ways of sending these subliminal messages that says, you know what? Back off, don't touch me. You offended me, you hurt me, but you don't have the courage to sometimes speak and say, listen, you really hurt me the way you spoke to me today. And you have to be open and transparent in your relationships so that you're able to share in a peaceful way to get the desired. You value your marriage. You value your children's relationship. You value your employees. And so it's very important for you to recognize that there is a problem and deal with it, but forgive them and go to them and say, you know what? I am sorry for what I've said or how I said it. And please forgive me. I was emotionally unstable at that hour, what I said or how I did. And I'm really not intended to hurt you or harm you. And I think that brings down the pressure and it helps you to restore. And also to say, I forgive you. I forgive you for the way you spoke to me. I forgive you for the way you treated me. And I want us to go on because this relationship is very important to me. You set yourself free from any bondage when you have the power to forgive. Yeah. And that's anybody, anytime, anywhere. Forgiveness increases productivity. It increases job performance, healthier life, reduces stress, you sleep better, and you're more in control of your life. And that's my experience.
Okay, Dr. Whitfield, we have a question for you. And it's, my spouse was diagnosed with erectile dysfunction. What are your views on penile implants?
I don't know that penile implants are indicated for erectile dysfunction. Erectile dysfunction happens more often than not because of high cholesterol levels that block the artery, the penile artery. And so the solution is to try to address the issue with medications and healthy lifestyle to address that. Now, penile implants are typically used in persons who would have had treatment for prostate cancer because surgery and radiotherapy can damage the nerve that controls the penis. And so that is not ED, that's more referred to as impotence. So that's the area where penile implants are initiated. And the issue with penile implants has to do with the loss of spontaneity, because you have to blow up the implant anytime that you're going to have sex. And so it's something that you tend to blow up. ED by definition has to do with, like I said, blockage of the arteries that go to the penis that does not allow for adequate erections. For some of those folks, we put on the ED medications, and they seem to help. So it depends on what is the required need for an implant. If, like I say, it is because of paralysis of the organ caused by the side effects of the treatment for prostate cancer, then yes, people sometimes they would use those. But if it's ED, erectile dysfunction, that's more of a medical management thing.
Okay, thank you. Do we have any other questions for Ms. Smith or Dr. Whitfield? So once again, I want to thank our panelists for joining us this evening. Ms. Rogers, back to you.
Okay, thank you. We surely benefited from the information shared from our panelists. We thank them for partnering with us, and to you, our viewing audience. We had a survey there. We hope you would have taken some time to complete it. We would like to have your feedback on the sessions. And this is part 1 of our Wellbeing series. Part 2 is on March 8th. So we will be sending information out. If you wish, you can just drop your, I guess, telephone number in the chat. If not, we will continue our circulation. We also have the information on our website. You can find it, but we thank you and we hope that you found this information beneficial. Share with others when we send out again. And we just thank you again. And our panelists, many, many thanks to you. We will be sending your gifts on to you. Thank you for making this a very enriched evening with information that we can all benefit from. Women's health, men's health, emotional well-being are all things that we can identify with. And I'm sure we're all leaving with some tips that can better enhance our well-being. Many thanks and good evening.